Okay, lecture 8.2, we are going to focus on the pelvic girdle today. So that consists of two coxal bones, all right, called coxal or pelvic bones. It also includes that fused sacrum and coccyx that forms the posterior portion. And then there's going to be a piece of cartilage that sits right here connecting the two pubic regions of the coxal bones, and that is called the pubic symphysis, all right? So every single coxal bone, so here's your intact pelvis, but each coxal bone individually is going to be the result of the fusion of three bones. So you have the ilium at the top, so like where you put your hand on your hip would be the ilium. The ischium is down where essentially your hip joint is, where it's going to articulate with the femur. And then you have this portion here that is located on the anterior side that's referred to as the pubis. So we're going to take a look at all of those structures before we look at them individually. The first marking that you need to be able to identify is this circular, essentially fossa that's located on each coxal bone. That is actually the result of all three bones together. And that's where they all kind of meet up, and that's called the acetabulum. And that is where the head of the femur articulates to form the ball and socket joint of the hip. All right, and you can see that there. One thing that I would make note of anytime you have just a singular hip bone in your hands, you want the acetabulum to be lateral, okay? You want this pubic tuberosity, so this bump on the pubis, to be anterior. And you want the fossa to curve, what is this? Concave, right? Yes, concave fossa, all right, facing medially. And you'll notice here that there's kind of a rough tuberosity portion. That's where the sacrum is going to articulate, and that should be posterior. So all of those things, and then looking through the obturator foramen, all of those things tell you that this is your right hip bone, and this would be your left, okay? The reason we want to know that is so we can look at both lateral facing structures, so structures that face towards the outside of the body, and then medial facing structures when they face inside, okay? You can see here in the picture showing you nicely where the ilium, ischium, and pubis are located. Anytime we look at one of these markings that I'm about to run through, you want to make sure you know which part of the coxal bone we are on, all right? So we're looking there at, that's our right hip bone, a lateral view. We are going to now focus on a few of those features here, okay? So starting with the ilium, so that's this kind of flare portion at the top, or a superior part of the coxal bone. For that, you need to be able to identify, I think, four things, all right? So first is the ala. The ala is this whole structure here, kind of like a giant wing or a giant cape, and that's your ala, all right? That big wing portion of the ilium. Then you have the iliac crest. The iliac crest, as you can see on your screen there, is this portion here, kind of protrudes out a little bit, just like the crest of a wave would be curling over, and that is your iliac crest. This big portion would be referred to as the ala, the crest portion located here, kind of that ridged portion on the superior lateral side of the ilium, okay? In addition to that, you have the iliac fossa. That's a medial portion here. So I'm just going to switch. All right, that's that smooth concave surface that I mentioned. And then you have a structure located on the posterior side, and that's called the greater sciatic notch. So I know you can't see me now, you can see me. On the greater sciatic notch, that allows for obviously the sciatic nerve, as well as some vessels to be able to make their way from the spinal cord down the pelvis and into the leg. So those are your four markings that you have to be able to identify for the ilium. Going back and taking a look at the second portion, so where my hand is gripping now would be referred to as the ischium, all right, or normally sometimes called the hip portion, because that's where the bulk of the actual hip joint is going to take place. For your ischium, you have a couple of markings, I think 3. So for your ischium, firstly, you have on the posterior side, you have this little bump, and that's called the ischial spine. All right, so that kind of bumps out again. That's on the posterior side of the ischium, is that ischial spine. Just below that is created a second notch. So you have the greater or larger sciatic notch here, and then you have the lesser sciatic notch that is a result of that ischial spine. All right. And then lastly is on the inferior surface, you have this rough bump portion, and that's called the ischial tuberosity. Again, providing for significant muscular attachment, because obviously if we're talking about this being our pelvis, what's sitting here and here are two giant gluteal muscles, aka our butt muscles. So we have lots of muscular attachments that are going to be attaching to the pelvis. Ischial tuberosity is one of those places. All right, so again, ischial spine, lesser sciatic notch, ischial tuberosity, okay? All right, and last but not least is you have this section of the pelvic bone, which is called the pubis. You do have a pubic tubercle here, not a bad idea, and the pubic crest, just for reference, but we're not having you identify them for assessment purposes. Here, where these two bones connect would be a piece of cartilage, and that's called the pubic symphysis, made of the same type of cartilage that your intervertebral discs are made of, that are located between your vertebrae. And then you have a structure that is the result of both the pubis and the ischium, and that is this foramen right here, and that's called the obturator foramen. So that is a creation of both the pubis and the ischium to form that opening, and again, that is a point for blood vessels to be able to make their way from the upper body into the lower limbs. Okay, scanning back through, that is your two pelvic bones and the three bones that fuse to make it up. Here is a view of the full pelvis, so just a couple of structures I can't show you. There's that pubic symphysis, that piece of cartilage. Important to have cartilage there so that the birth canal is able to open up to allow giant baby heads to make their way out. Lastly, I do want to take a moment to talk about the difference between male and female, the difference between a male and a female pelvis. So you can see here, there's a couple of structures that are focused on, and that has to do with this pelvic inlet, pelvic brim, pelvic outlet situation, and creating the space in which the pelvis makes based on its structure. And a lot of that is hormonally influenced as well as genetically influenced. And so what you end up having is you end up having that pelvic incidence or that pelvic angle that I mentioned previously. So just make sure that you do take some time in the text to look at these differences. In a female pelvis, as you would probably imagine, it's going to be much broader. It's going to have less prominent markings, so it's going to be smoothed out. It's going to have a shallow pelvic base, but its pelvic outlet is going to be much, much wider, okay? So if we look at a comparison between the two, even if you had none of this stuff labeled, like if none of these things were here to give you clues, if you looked at this pelvis and this pelvis, hopefully you'd be able to identify that this pelvis looks like a baby can fit through here much easier than this pelvis. A couple other identifying features, I would definitely scan through and take a look at these. But again, you can see that shallowed, flatter, broader hips. And then you can see the much sharper angles for the male pelvis with those iliac crests and alas much more straight versus the broader one of the female pelvis. So do take some time to kind of scan through. We'll talk in class about some differences between the male and female pelvis as well.